A lot of medicines I've seen, when I read the literature, they talk about checking kidney function before you begin to take the medications. And I can imagine anybody who reads the literature is like, kidney function? I have a serious problem I want to attend to. I want to administer this medication, and they're asking me for kidney function. Let me do the medication first. And of course, once you start getting better, or the person you're treating starts getting better, they forget about the kidney function.
No, it's very important that people should know the state of their kidney function. I think it should be part of the routine. Once a year, you go and see your doctor.
But if one were to go for a routine checkup, would it be one of the things they check?
Oh, absolutely. It's one of
without the patient asking, please also do a kidney function test.
It is. We check the kidneys, we check your blood pressure, check for blood glucose, check for liver function. They're just simple tests. All you need is draw blood, take to the lab, and then also check the urine to see if there's leakage of protein. The urine is...
They do that a lot for pregnant women, so they should catch them at that point.
Exactly. And then in most clinics, most specialist clinics, it's part of the routine examination. We ask patients to come with their urine and we'll test immediately. You get your result.
Now, if somebody were ill and were given a medication, and you find out the person has a compromised kidney function, but the person needs the medication, what is then done?
You will have to adjust the dose of the medication. You know why it is so important? It's because the kidneys excrete most of these medications. Some of them are excreted unchanged. Some of them are, or some of the medications are already changed, but it is the kidneys that largely excrete them. So if the kidney function is compromised, that means you have a buildup of these medications, even our own orthodox medications. So what we do is, if there are no substitutes, and you must use that medication, then you have to be very careful and reduce the dosage.
So it's essentially making the best of a bad situation. It's not like you're going to eliminate the risk, but it's going to be reduced.
If there are alternatives that are much safer, we would rather use alternatives. But if there are no alternatives and that individual needs such a medication, then you have to reduce the dose. For instance, if the medication is supposed to be given 3 times a day, depending on the severity of this condition, you may reduce the dose by half or 1/4. So normally we adjust, what we say is we adjust the dose of the medication to alongside with the state of the kidney.
Of the person's kidneys.
Yeah. But what we would rather do is to avoid it. It's if we don't have options that we give the medications.
So who is at risk for acute kidney injury?
The elderly one.
Uh-oh.
Being elderly, being a black person. For some reason.
So it's more common in blacks than
It's more common
other
in
races.
blacks than in other races.
For any reason in particular?
I think for some reasons the black man's kidneys are genetically programmed for kidney failure, whether acute or chronic.
But you know, there was a time we weren't having so much news about kidney problems in this country. And then all of a sudden, it's like every other week you're hearing of somebody with a kidney problem. What was responsible for that? Do you know?
1 is increased awareness. 2, we take a lot of things without reading labels. We're not very health conscious. We don't practice prevention. We wait things come announced before. And then, of course, is the rise in the prevalence of hypertension, diabetes in the society.
Okay, so all those come along.
Yes. Use of analgesics indiscriminately, herbal medications, infections. So all these interact to increase the prevalence.
Okay, so the elderly.
The elderly.
Being black.
Being black. If you have high blood pressure, if you have diabetes, use of herbal medications. If you have very severe infection that we call sepsis, you're already predisposed to acute kidney injury. And of course, being dehydrated. Most people don't drink enough water. And our environment is very hot. The kidneys love a lot of water.
The more the better.
The more the better, because it increases the flow of blood to the kidneys and make them work better. So being dehydrated, not taking enough water, and all those conditions I mentioned earlier on.
We're talking acute kidney injury. This is the time when you can call in and ask questions relevant to the topic. The number to call is 0808 054 2233. That's 0808 054 2233. And already Amusa is asking that she needs more information about what you mean by metals in water. You know that colored water thing you were talking about. What do you mean by metals?
Okay, some of the individuals color it with copper sulfate. Copper sulfate.
Copper sulfate.
Exactly. To make it have the desired color, green or blue water.
But there's food coloring. Wouldn't that work better?
I don't know. Ignorance. Ignorance. I guess it's ignorance. So that's what I mean by metals. And then sometimes you get contamination with mercury. And mercury is very, very toxic to the kidneys.
So those are the metals we're talking about.
Yes.
How do they get copper sulfate? Is it a liquid thing, liquid form or what?
Like it's not powder or in a semi-solid form. You just drop it and it dissolves in the water and gives it the desired color.
And just goes straight to damage the kidney?
Oh, straight. It's a heavy metal and the kidneys can't handle it very well.
Okay, you spoke of asymptomatic kidney injury,
yes.
Especially when it's mild and maybe in the early stages, the person doesn't have any symptoms. Are there ways of preventing this kidney injury? Are there things people can do to minimize the incidence?
Yes, it's two ways. For the community, people should keep well hydrated.
Okay, water.
Drink a lot of water. About 2 to 3 liters.
Some people don't like water. Is it okay if they color it with something, or shall I say maybe not color, flavor? Like lime, you know, something.
That's okay.
Because for some reason they feel they can't swallow water like that.
It's okay, so long as it's not all these fizzy drinks.
Okay.
It's fine.